Majority Leader.
Mr. President, I ask unanimous consent the quorum call be suspended.
Without objection.
Mr. President, on Friday, funding for the Department of Homeland Security will expire. When we passed a short 2-week stopgap for the department, at Democrats' insistence, many of us said it would not be long enough. I made that case repeatedly. Standing here today, I regret to say that we have been proven right. The renegotiation that Democrats demanded with the Trump administration last month is, unsurprisingly, taking some time. Democrats took more than a week to coalesce around a set of demands. And it was just this past weekend that they put those demands into writing. On Monday, just 2 days later, the administration countered, and I expect Democrats will shortly receive detailed text for further consideration. A quick turn, I might add, after a long wait. By any measure, a good faith engagement from our friends at the White House. Do I think the parties are on a path that could culminate in a deal? Yes. Will they need more time to get there? Absolutely. So I hope our Democrat friends will remain at the table and give talks more time to mature. The alternative path should interest no one, and that is a needless shutdown that will see funding lapse for our Coast Guard, our cybersecurity, for airport security, and for disaster response. Mr. President, we've been able to pass 11 of the 12 full-year appropriations bills into law this year. And as I said, I'm hoping that we can get that 12th bill done soon. We've made considerable progress this past year restoring a regular order appropriations process. And thanks in no small part to a more open process, this year's appropriations bills delivered significant wins for the American people. Today I want to take a moment to talk about some of the health care wins for Americans in the most recent appropriations package. This most recent package included a number of member-driven priorities to bring down the cost of prescription drugs, increase access to care, improve health care quality, and support treatment of diseases that affect literally millions of Americans. And I want to thank Chairman Crapo and Cassidy for their leadership in crafting this package and for literally years of hard work on these issues of great importance to the American people. Mr. President, one of the top issues for the American people is the cost of prescription drugs. It's not a problem, I should say it's a problem not just in my home state of South Dakota, but around the country. And the status quo is challenging for patients and for independent pharmacies that often serve small towns and rural communities. But under the Republican majority, Congress has taken concrete action to drive down costs at the pharmacy counter. That starts with Pharmacy Benefit Manager, or PBM, reform. Mr. President, the recent appropriations package included provisions from 2 bills to address PBM practices that can drive up the cost that consumers pay for prescriptions. Policies from Senators Cassidy and Marshall's bill, the Pharmacy Benefit Manager Reform Act, will increase accountability and transparency for PBMs. And when a PBM gets a discount or rebate from a drug maker, this bill ensures that those savings are incorporated into the health plans that many working Americans rely on to afford their health care and prescriptions. Mr. President, we also included in the appropriations package provisions from the PBM Price Transparency and Accountability Act, authored by Senator Crapo and supported by nearly all the Republican members of the Finance Committee, which removes incentives for pharmacy benefit managers to promote higher-priced medications at the expense of seniors. This bill also reinforces requirements that protect independent pharmacies and ensure that they can continue serving their communities. Mr. President, in addition to these common-sense policies, we also took action to improve access to generic drugs, which are often a more affordable option for millions of Americans seeking relief for different health conditions. Senators Paul, Husted, and Lee worked together on the Transparency and Generic Drug Applications Act, which streamlines the approval process for generic alternatives to brand-name drugs, which will help ensure that these safe and less expensive alternatives reach the market more quickly. And that's not the only thing we did to help accelerate access to medications. Senator Mullins' bill, the Michaela Nalen Give Kids a Chance Act, will drive development for pediatric cancer drugs. Sadly, Michaela Nalen lost her battle with cancer this past October. For 5 years, Michaela sought treatment around the country, and she was a tireless advocate for other children with cancer. And this law is a fitting tribute to Michaela's fight. Mr. President, we also addressed access to treatment for children with significant health care needs and rare diseases. Senator Grassley's Accelerating Kids Access to Care Act simplifies the process for children on Medicaid and the Children's Health Insurance Program with complex medical conditions to get care outside their home state. Unfortunately, regulatory hurdles have too often stood in the way of parents' efforts to get their children essential care, wherever it may be located. By removing red tape, Senator Grassley's bill will help ensure that vulnerable children can get the expert care they need when they need it. Then there's Senator Capito's Innovation in Pediatric Drugs Act, which closes the research gap between rare disease treatments for adults and children by ensuring that drug makers conduct pediatric studies on drugs for rare diseases. Mr. President, I'm also proud of what we've done to improve access to care. In the Working Families Tax Cuts, we took measures to support rural hospitals. And the appropriations package also includes support for patients to receive care at home. That starts with extending telehealth waivers that have become a critical lifeline for so many patients living far from a health care provider, like patients in rural areas. It also includes Senator Tim Scott's provision on the Acute Hospital at Home Waiver Program, which helps continue a successful program that helps Americans get the acute care they need without having to be admitted to the hospital. Mr. President, there's a lot more I could talk about when it comes to health care wins for the American people. There are Senator Collins' provisions to support type 1 diabetes research and help family members acting as caregivers. Senator Marshall's Fair Billing Act, which will help ensure that patients are billed appropriately based on where they receive care and will empower them against unfair facility fees. And Senator Crapo's work on coverage for multi-cancer early detection screening, and Senator Bozeman's work to support organ donors and moms with preemie babies. Our most recent appropriations package contains numerous health care policies that will benefit the American people. It will help bring down health care costs, improve access to quality and affordable health care, and ensure that the United States remains a leader in health care innovation. And it will help ensure that innovations can reach the Americans who need them, especially children. Mr. President, we passed 11 full-year appropriations bills by engaging members of both parties, and every one of these health care wins is a result of that work. And when I say wins, Mr. President, I don't mean for the senators and congressmen who wrote these bills. These are wins for the American people to help them live healthier, happier, and longer lives. Mr. President, I yield the floor, and I suggest the absence of a quorum.
The clerk will call the roll.
Ms. Osterbrooks.